Hi, I'm Elisabeth. I'm a geologist and a community college geology instructor, and I am an iFuse patient. I first noticed my SI joint pain about 20 years ago. One time I was riding a big thoroughbred mare, and unfortunately the footing was bad and the mare and I both fell, and she landed on my hip. And I traced the SI joint dysfunction back to that time. And initially my physical therapist, who was a very progressive physical therapist, mentioned that it might be SI joint related. I also tried injections of the SI joint, and at that time I was able to tolerate steroids. But as with many medicines, I became allergic to the steroid injections, and they really weren't enduring or very long lasting, so the pain continued. I did talk to my physical therapist about surgery, but the SI joint surgeries at that time, this was about 15 years ago, were very difficult, dangerous, and not very effective. Mostly it was lifting, twisting, bending, things like that, or uneven ground. I remember so many times I couldn't lift the whole bag of groceries, so I would go to the store and have them help me take the groceries out to my truck or car. And then I would get home and have to carry them in like one item at a time, unpacking everything, and just so many trips back and forth. So in the more recent years, I just thought there must be something that can be done to help. And I found some literature reviews on the SI bone and the iFuse system. And I was instantly excited because it seemed so different, being minimally invasive compared to the old way that surgery was done. Once I did the research and I found the SI bone website, I called directly to the nurse line, and Sue called me back and provided a list of doctors and surgeons who were doing the surgery. And I was able to use that information to find Dr. Gerlach. And I was worried I might not be a candidate, but he did the tests and I was a candidate. I was so relieved that he actually believed me that it was a problem, because even though my physical therapist was on board and we knew what was going on, many surgeons and orthopods just don't seem to believe the SI joint has any bearing on pain. And it's very difficult to find someone who actually listens to you and takes the time to do those tests and even has a solution. When I woke up from surgery, I was so amazed that I felt no pain in my SI joint. And it was such a change and difference. It was stunning. I could tell there was a major difference in my body, and it was incredible. So the journey with my SI joint fusion and this work I'm doing now in my career, it intersects about a year ago when I had the surgery. So I started my doctoral work in education, and really having had that SI joint fusion allowed me to focus and have the energy to get through this very rigorous process. And now I hope to use it in a fellowship in science policy.